Uncommon Disease Tracking System for Project 2 in ISC 555 by Venkata, Santosh and Suresh. Objectives for this presentation are business case discussion and system demonstration. Business case. Uncommon Disease Tracking System is a web-based system that helps in tracking the uncommon diseases. What are uncommon diseases? Uncommon diseases are the diseases that prevail only in specific locations around the world, and they are not so common in US. When people from US visit these locations, or the people who stayed in these locations are affected by these diseases and they return to US, the local doctors may not identify the diseases uh, in all the cases, and they treat them as a diseases which they are familiar with. And this results in a delay in the treatment, exact treatment that is required for the patient. Hence, this system can help in quick diagnosis of the diseases, which can uh, result in early starting of the treatment for the patients. In the past few years, there was an increase in the number of international traveling for various reasons, and most of the travelers from US are heading to developing countries. Among them, 1% to 5% of the are seeking for medical care after returning to US, and most of the cases these diseases are not so common in US, and the local physicians are not familiar with diseases in all the times. I have a personal example here, where one of my relatives uh, visited to US recently. Before coming to US, she was infected by a chikungunya virus, which is common in India, in some not only in India but in Africa and in African and Asian countries. And she was infected by chikungunya virus. After coming to US, the disease got worsened, and she had to consult the local doctors. The local doctors, after seeing the symptoms, they treated it as the diseases which they are familiar with, and this couldn't solve her problem for a long time. And finally, the doctors had consulted uh, her personal doctors who are in India, and after seeing the reports and uh, records that are related to her health, and they identified it as a chikungunya, uh, and they suggested a treatment required for the diseases, and this solved the problem. There are many such type of cases where the doctors in US are coming across the diseases which are not familiar, but they are curable because they are prevailing in different locations around the world. Hence, this system could be able to track all the uncommon diseases and the locations in which they are prevailing, and the time uh, and for the time they which prevail or prevailing. And this can help in quick diagnosis of the diseases and prevention of the delay in the treatment. Goals are to provide a user-friendly system for entering the details of the patients, diseases, and locations by the physicians or the healthcare organizations, so that they can view at any time in the future, and they can pull off the reports according to their necessity. And this should be able to diagnose the disease quickly, and should also produce reports that provides useful information, and by looking at a glance they should be able to get information and identify the treatment that is necessary for that disease. Since this system uh, have the lot of information about the diseases locations and patients, most of the healthcare providers or the doctors should be able to access this system, and integrating this with the CDC website, which is similar to this system, uh, and having information about the diseases and the locations in which they are prevailing. It can provide more information by centralizing this system around the hospitals, all the hospitals around the US. Can be more useful. The risks and issues that are associated with this system, or there are thousands of diseases which are not common around the world, and entering these diseases may not be possible, and centralizing this system may also become difficult because all the hospitals have their own, or implementing their own systems, and integrating this system uh, may become problem in most of the cases. And chances of misleading, if the symptoms of the patient who consulted the doctor are compared with the symptoms of the diseases that are already present in the system, they treat the disease as the disease which is present in the system, but this disease can be another kind which is having the same types of symptoms, and this can be a risk for the patients. And if the physicians or the local hospitals uh, do not enter the details correctly, this can they may create some problems. The business impact that is associated with this system is it can reduce in delay in diagnosing the diseases, so that the treatment can be started quickly, and alert the tourists or the patients who are going to visit new locations. They can view the various diseases that are prevailing in these locations, and integration with the CDC website will provide more information, because this is also a similar website which is having information about the diseases and the locations, but we are adding patients details also in our system. Healthcare providers may show interest in implementing this system because uh, this is having a lot of information about the diseases which are not so common in different locations, and this can be a useful resource or a website for the tourists. The tourists can view this website, and they can uh, take precautions according to the diseases that are prevailing in the locations they are going to. And there are thousands of uncommon diseases, and entering all these diseases in the system may become a constraint. Integrating this system uh, is also a constraint, because every organization have their own system, and integrating this system is uh, most of the cases will be a difficult for the organization, because they have to spend uh, more on for integrating the system. Now we look at the software, how it works. This is the system where we are storing the data about uh, the diseases and the locations in which they are prevailing, and the patients who visited these locations, and the diseases they were affected by. It is not necessary that the patient should be affected by diseases, but the patient can be entered here, and the location is associated, since the location is associated with disease, by we can get the information like when a patient visits a place and come back to US and affected by a disease which is not so common in US, then they can use this system so that we can compare the diseases which are prevailing in the locations where this patient has had been recently. Uh, this is one of the examples of reports that we can generate from this system. In this report, we are getting the information about different diseases that are prevailing in different locations around the world. And for example, here in Angola, a country in Africa, is prevailed by yellow fever, and this is the symptoms that are related with this fever, and this is a time uh, between which the yellow fever is being in existence. Here, it was identified for the first time in 1935, and the end date means it's still being in existence. By looking at this report, patients or a tourist can be alerted by uh, uh, the locations they are going to. For example, a person is going to in Finland, is planning to go to Finland. If he sees the system, he will look at the diseases and descriptions, and according to that, uh, he will take precautions, and or else he may not go to that place. And this is the patient disease, where we can get the information about patients can the disease the patient can be affected. For example, uh, Alistair Jones uh, visited Helsinki, Finland recently and came to US, and he was affected by some disease, uh, and the doctors were unable to find it. They'll just enter the location name and the time for which Alistair Jones stayed in Finland, and they will get some information about the diseases that are prevailing in Finland and the symptoms for the diseases. They will compare the symptoms of the diseases Jones was affected with the symptoms uh, that are present in the system, and so that they can come to an idea about which kind of disease he might be uh, affected, and according to that they can start their treatment. And similarly, there are other records which was, for example, Alfred Smith visited Knowledge Jamaica recently, and he might be affected by dengue, or some Taylor Rogers visited Cambodia, and he was affected by Japanese encephalitis, and it was diagnosed for the first time in US for Rogers Crety, and this can be entered in the system. Is just an example how the physicians or the healthcare organizations can select. For example, they want to view information about a patient uh, who was suffered from uncommon disease. It will give the information about Ryan Murphy and the disease he was affected, and the location he visited where the disease was prevailing. For example, Alistair was suffered from Lyme disease. Cyril Carl was suffered from chikungunya, and Dane was suffered from yellow fever. Like this, we can get useful information from the system. and thank you very much for watching our video.